The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Hi, welcome to the Cashman Mind, Body, Spirit show. Today's show is very interesting, a little different than my usual wellness show, but I'm speaking today about a system of medical care. Now, I've been at this for a long time, okay? I mean, at age 39 for the 44th time, okay? I've practiced medicine for many years, so I've seen all aspects of it. But I'm looking at this. This is a political year, and this is, I think, the time to propose something that could help of either party, and I'm picking parties, to win the election. I am convinced if the person running, either party, were to present a system of health care that treats everyone the same. Wow, what are you saying, Rudy? What I'm saying is today, many people don't have insurance. Many have huge deductibles. Some have Medicaid, which doesn't pay the provider anything, so they're hesitant to see them. Medicare is pretty good, but it doesn't generally cover dental care and eye care, for example. If you order special insurance, you can get it, but what I would like is for everyone in the nation to have the same program. Medicaid will be upgraded. Medicare would even be better. I didn't say no Medicare. I said it would even be better. The veterans, which have a pretty good system, but you hear about problems with it. Access, for example, you got to go to Chicago. I think the veteran would be great if he had a choice. Isn't that great? Have competition between the Veterans Administration and the private hospital, and let the veteran decide who he wants to see. You know what's going to happen is they'll both get better. They can see the doctor down the street, use the hospital in his hometown, so I wrote this short book. You can read it in a day, but I did a lot of research to write it, and I tried to keep it easy to understand, so a child could just about read it. But you notice on the cover, I have all the people in a circle all holding each other's hands, surrounding a flag. What am I saying? People of all colors, all races, all ethnic groups, we're all in this together. We're all treated the same. And to me, this is the perfect political year to do it. I'm picking neither party, and the House and Congress, if they're local people, and considering the things that have happened with the virus, for example, people are having to go to the doctor, they don't get any insurance. Half the people don't take the medicines they're supposed to because it costs too much. Well-to-do people aren't going to the doctor because, like myself, my wife had a $5,000 deductible. We paid it last year, and in January, it started over again. Even for a fairly well-to-do person like myself, I'm paying attention. This is a significant amount of money. Okay, I can imagine a person that isn't so well off who's got a $5,000 deductible. You get some dental care, and I had a cup of teeth replaced, and that'll be $8,000. My insurance maybe paid $300. You see the point? That would be part of Americare, would be dental care and eye care and new glasses. And you might say, well, that's going to cost a bit. I will explain to you how it is to be paid for, and we'll get to that. So I wrote this book. So I think it's a moral responsibility, especially, say, in Switzerland. Everybody treated the same. They feel they're all in the same boat. It's how I would like to look at it, okay? A system of health care that treats everyone the same. That's the goal. And we got to keep it simple. We can get lost in the details right away. Someone who doesn't want this program will mention all sort of things, can't do this, can't do that, and we'll never have it. Number one is, let's have the program called Americare, and then we'll work out the details. So let's have a straight line to the vision, okay? The vision is to have this system of health care in this political year. Details, they come later. But because if you don't have the program, it ain't ever going to happen. It can be micromanaged to death. The politician mentioned this and that, and I say everyone's included, including people coming from other countries, including visiting. Everybody's in this together. A straight line to the vision, okay? Otherwise, we will never change. Personally, I think that could win someone the election. Suppose Trump or Biden propose this. I think this would overcome any opposition. I think we're all thinking the same now. We have to have medical care. And how would you possibly, and I said either party, and I'm backing either party, how would you possibly pay for it? I studied 13 other countries. First thing I learned is that many of them aren't as bad as you think. You know, we say, oh, England and Canada, socialized medicine. Well, for one thing, they do have some lines waiting to get elective surgery done. But a couple of things it does which go along my way of thinking. Remember, I practiced medicine 45 years. I've had a lot of experience. And the one thing that I noticed, probably 70% of the things we doctors are doing and the pharmaceuticals we're taking are not necessary. Mm-hmm. So when they make the people wait in line in Canada or England, they are preventing from a lot of people having work they didn't need in the first place. That's true. I noticed in England, I went to a doctor's office there just to see how they do it. Their family doctor signs everywhere on prevention, everywhere on prevention. And the doctor gets paid according to the preventive teaching that he did. Instead of sitting there and here's your script, see you in a year. He's teaching you how to avoid vascular disease, how to prevent reverse diabetes, how to get your immunizations and shots in time. The doctor gets paid for making sure that you were immunized. And when you look at today's epidemic, how important that really is, that the children are getting all their shots, for example, which is very complex. But in England, they pay him. If he only gets paid if he gives that shot to that child. So what do you think is happening? The nurse is calling up and telling their family to bring the kids in to get their shots. Mm-hmm. In this country, you don't want shots, you don't get them. 30% of our children are not immunized in this country. Mm-hmm. It's true. You may not know that. So when these epidemics come along, like there will be other ones beside the virus 19 this fall, and there's some who don't believe in immunizations to begin with on a moral or religious basis concerning public health. That's a problem because they're going to get these viruses, because they're around, okay? Those viruses are around, and they will then spread it among the population. It's complex. It's complex. That the doctor is motivated to get you immunized, I think, is a good thing. It's a complex issue. I'm not discussing both sides of that. I'm just saying that you can get it. And let's get to how to pay for it. Okay, let's put it right up front. What I found in these 13 countries I studied too, what two of them were doing is it's a VAT tax, value-added tax, which they add to goods in countries in Europe and everything, and but it's not itemized. So when you buy something, it may be slightly more expensive because it's raising money to give you things that you need in your life. But they call it a healthcare premium. It's a tax. So it's a small tax on every financial distraction. You might say, well, I don't want my taxes raised, but for that, you get Americare. You get Americare now. You don't have to buy insurance. And that can be very expensive. And we're all treated the same. We're all in the same boat. And people visiting, and people who don't want to buy insurance, which really makes it more expensive for all of us because they're not paying their fair share. They're paying now because of all financial transactions involve a little bit of money. The rich will pay more, which they pay more taxes. Let's face it, half the taxes are paid for the top 20%, pay 80% of the taxes, okay? But in the well-to-do, it's not a special assessment. They have more, they buy bigger cars, they buy a lot more goods, they have bigger homes. So all these transactions have a small tax on them, not at a special different rate, at the same rate, but they're paying more because they spend more. That seems fair. You know, that seems fair. For that, you get insurance that covers everyone. So I think a healthcare premium, which you won't notice because it's just a slight rise in things you're buying, but for that, you're getting this wonderful insurance plan. You don't have to put out those $3,000, and you might spend a little less because of the tax. I don't know if you did, but you don't have a $5,000 bill or $10,000 bill coming, okay? And when you go to the hospital today and you have no insurance, that'll be $50,000, that'll be $100,000. I mean, nobody can afford that, and you got to make payments for the next 10 years. That's gone because you're covered, okay? So what I'm trying to say is, if this gives you some thoughts, contact your politician or speak to your congressman, whatever, or give me some ideas how to reach these people who are running for public office. Either political side, if you can, for me, get a personal appointment to talk to any of those, that's worth a little bit of money to me. And I would, if anybody can arrange that for me, contact me. I give you some reward, some financial award for doing that. But you have to watch out for the lobbyists. You have to watch out for the sugar industry and all these things who want to keep on selling you processed food to make you unhealthy, to keep the hospitals full. Some hospitals might think it's a great idea because the company or the CEO has got a heart. He sees the advantage to everyone being covered, but other ones who might just not want this system because they can charge outrageous prices. Some of them even charge this huge price and then reduce it a little bit compared to, say, Medicare. But the price they charge is always the same, and you get the same bill. And let's face it, all of us, when we look at medical bills, we just go like this. That's what goes on in my house. Wouldn't it be nice if all you had is maybe a small deductible, because you're a little bit well-to-do, and the ones who don't have much money, a certain level, say 75,000 under, no deductibles. Wouldn't that be nice? That's what I got in mind, and the healthcare premium would help take care of that. But the healthcare cost itself would actually be a lot less. We would be. Another thing I would include is if you wanted to use insurance companies. I'm not against this being the government. We could use non-for-profit insurance companies, which they do in a lot of countries. Yeah, and politically this would work well. In Taiwan, for example, it was actually a Republican party. It looked like it was going to lose the election because the other party in Taiwan had proposed health care for all, a total program, which they did not have in that country. They only the rich had insurance. The rest couldn't afford to see anybody and had huge bills. So the Democratic Party, which was going to lose the election, presented that and looked like the Republicans were going to lose big time because of this new program of health care. But you know what happened? That Republican Party decided to propose it themselves. Guess what happened? They won with 75% of the vote. Same thing happened in Germany. Otto won Bismarck, 1890 or so, which brought the German federations together. The other party running against Otto proposed the Krankenkasse, health care for all, and a small Social Security system. He was going to lose big time. So what did Bismarck do? He opposed it himself, and he won the election big time, and they've had the Krankenkasse since 1890. You know, it's been changed and modified, and now they have some non-for-profit insurance companies, where the insurance companies actually, indeed, do compete against each other. Actually, it happens, but they're not for profit. There we save another 20-25%. Do you see what I mean? We cut out unnecessary surgery, at least cut back on it, okay? And if we have everyone has health care, maybe we could teach patients how to get well, what to eat and exercise. And every doctor visit, like in England, there's some talk about wellness, how to get to the root of an illness, not get it in the first place. Type 2 diabetes is a great example. Type 2 diabetes has attached to it 30 to 50 diseases. Mm-hmm. We're letting people have it so the industry can make their money. So we give them medication, metformin and insulin. I've been reading some books lately, one by Jason Fung, F-U-N-G. You can get them on YouTube too, F-U-N-G. And what he's saying, which I totally agree with, I confirmation, is that those medications actually cause the disease. Mm-hmm. I read it. I know the science. I don't have time to discuss that in detail. I will in my diabetes show, which I'm doing next. They actually cause the disease. Mm-hmm. But does the medical profession, the medical school, industry, pharmaceutical companies, do they tell us that? No. They let us have the disease. Again, a huge saving. We worked on the diabetes. We learned to understand what the mind does to the human body. A lot of people have stress diseases. After people see a doctor, they may present with the symptoms, but the problem is stress. We taught them stress relief and start looking at medicine a little differently. What you can do with stress, for example, let me show you that a little bit. This mind of ours affects our body. Mm-hmm. Yeah. Candace Pert wrote a book called Molecules of Emotion, 1970, 71. I read it. I was a neurosurgeon, I read it. And she was looking through electron microscope at National Institute of Health, and she saw human cells with receptors on them, and something kept on hitting the receptors, and she then realized that our body, which makes hormones, neuropeptides, neurotransmitters, nano-sized molecules that hit these receptors. So how you think, whether you're stressed out or happy, those and along with nerves, hit these receptors with neurotransmitters and change how so we have, in essence, a second brain in our gut. 75% of our serotonin, that's our long-term feel-good hormones, are made in your gut. Yet, physicians are not trained to learn about the connection of the mind and the body in medical school. I've been there. Well, we can't teach it here because national isn't interested in that. So what am I telling you? 75% of illnesses are due to stress and thought process. And if you include that teaching that you can cross the borders with insurances, we teach the mind-body connection. We teach about stress and emphasize stress big time in Americare. You see what I mean? Cost probably would cut in half easily, because industry has been sidelined a bit, and that we propose a new procedure as helping this, that, and the other, and that it be properly evaluated by national system. Just because they make it and they claim it works doesn't mean that it works. Let me give you an example. They don't even teach at the medical school what the effect of a placebo and this evil twin, the nocebo. I bet you didn't know what the word meant. It's not taught in medical school. Negative speak. If I hand you a pill and you believe it'll work, 75% chance it'll relieve your symptoms. That's a placebo, okay? Yeah. And in Europe, they allow you to buy, for them to manufacture pills of different colors, which are more likely to induce a placebo. In this country, it's illegal. I wonder how that happened. The pharmaceutical industry is the one who lobbied and prevented that. And then we have the nocebo, negative speak. So now we invented the MRI machine, which helps us diagnose some things. No doubt about it. I used it in neurosurgery all the time. It had value. But the trouble is, we order so much of it, it's very expensive. And depending on your age, MRIs will show something. It'll show the process of aging, for example. I have no neck pain. Maybe it's because I exercise and I'm only 39 for the 44th time. Add them up. And certainly my MRI, my neck will show something. And if I went to a provider, a surgeon, for example, and I said I had some neck pain, which could be from stress, okay, or strain, or playing too much tennis or pickleball, and the surgeon will look at the MRI, the 3-page report, say, oh, you need your neck fused. Do I need my neck fused? Maybe the neurotransmitters, neuropeptides, hitting those receptors because I'm a bit stressed out. And a massage might be a lot better. You see the problem? So for providers not to know the nocebo, placebo, I wrote a book on that. It's on Amazon, maybe 30 pages long. You can read it in half a day. That would teach you a lot, because a lot of patients are going to a provider. That includes, chiropractors, osteopath, people who do things to people. At least they're not operating. You know what I mean? But they could be manipulating you, and you go on there every other day for about a year, costing you a lot of money, and maybe 5 treatments might have done it. So I'm not criticizing anyone. I'm passing out information so that you learn about the placebo and the nocebo. Again, could be a huge saving in healthcare costs if provider, for example, was on a salary instead of price per visit. You're not going to come back for a year if he's in a salary and not getting paid per treatment. Yeah. So free enterprise is involved in this a little bit. So let me, so to understand the connection of the brain to the body is really quite important, quite important. because we have in here the nucleus accumbens, 1 millimeter in size. It's the quick fix. That's why people smoke. Right? Oh, I'm in heaven. That's why they eat sugar. I feel great. When sugar gets converted to triglycerides, it makes you fat. It's sugar makes you fat. It's not fat makes you fat. It's sugar, because it gets converted to a fat. So to get proper blood testing is important. That's why we need insurance. A lot of people don't get their blood checked because they don't have insurance, and sometimes it's not extensive enough. I always encourage people to get besides maybe a glucose tolerance test to rule out diabetes, but to get an insulin tolerance test. That's abnormal 10, 15 years before the blood sugar. So I can anticipate you on the road to diabetes and it's 30 to 50 diseases. If we did serum insulin screening starting as teenagers, then people, all they need to do is lose 5 pounds of weight instead of 50 or 100. We could again cut medical care into half. So that's the reason I wrote a book called Rudy's War on Diabetes. Why a war? Because the government is not going to tell you how to avoid this problem. Pharmaceutical companies just want you to take insulin or metformin or some of the other drugs when they could be avoided the majority of the time. And then of all things, when I look at Josh Fung, F-U-N-G, you can get him on YouTube, what he's really saying, he's a nephrologist, kidney doctor from Toronto, from Canada. He's saying these drugs that I just mentioned, he's writing his books, actually cause the disease. We give it to people when we think we're helping them, which has helped some. Type 1 diabetics need some insulin, but if they eat right, they need very little of it. But in actuality, it helps promote the disease. Mm-hmm. A lot of people get obese because they're taking insulin. Insulin is anabolic. So to learn the science of that, I want you to learn more about it, okay? You don't just quit the drug. That's not what I got in mind. I want you to learn more about it so we can save a lot of money there by providing under Americare dental care. And then we teach kids to brush their teeth, which you don't hear much on the TV about, or education. You can avoid a tremendous amount of disease by teaching wellness with dental care, for example. I see people that are in their 80s on 15 medications. When I review them and look at them, maybe they needed one. I had a lady recently, and I'm sort of proud of this one. She had a pain here. I'd seen every provider you could dream up. And a daughter was with her and said, can't get rid of this pain. She's complaining. So I took a long history and understand the mind-body connection. She was living, although she had a daughter with her, living by herself. I suspect a big lonesome, perfectly normal reaction, maybe a little bit depressed. So I wrote a prescription. And you know what I wrote on the prescription? Get a little dog. And she did. So now guess what happened? I didn't know what happened. So about 3 months go by, and the daughter comes to see me with the mother, and the mother is carrying this small dog right into the office. And she said, looked me square in the eye, the daughter did, and said, I want to thank you. Her pain is gone. Okay? All I'm proving to you is the mind does indeed affect the body. Okay? But we could save a lot of money under Americare. We're all being treated the same, okay, which is a good feeling with all these racial things and viral things going on and racial disparities, and we finally would feel together, okay, just like the circle on my book, we would not see color differences and racial differences. We're all the same family. We're all in the same family throughout the world. So if we had non-for-profit insurance companies, opening of the borders, that people can compete across the borders with their insurances. The same with pharmaceuticals, which again we could cut way back on. An elderly person on 50 medicines makes no sense. Half the people don't even take the medicine they're prescribed. Maybe actually they're doing the right thing, because the medicines have a lot of complications. A lot of people die from complications of medications. Okay, and we should allow foreign pharmaceutical companies to compete. Like insulin's a big problem. Some people indeed do need it. Okay, although I bet you 80% of them don't really need it if you really studied the people and taught them some wellness. The price has been kept extremely high, especially by Eli Lilly, which had the first big patent on it. Quite high. Should at this point there should be a generic form and it should be extremely cheap, but it's not. People are making money. People are making money. I'm minding and making some money. I used to make a living, but to scam the people, and when it even makes them worse, when it's not even indicated, I'm sorry, I'm not for that. And you say, well, doctor, this is socialism. Well, let me tell you something. Actually, I have a chapter in this book on capitation. Capitation. What does this mean? Now that you've listened to me here for a bit, you can see where I'm coming from. Under capitation, let me give you an example. Suppose you took a company. This is make-believe stuff. Say General Motors, big company. Okay, great company. And they might go to one of the hospitals. You know, we get 3 hospital systems here now. Maybe go to all 3 and go to one and say for $20 million, I'm just making these figures up, I don't know everything more or less, you must take care of the health care of all our employees, everything, okay? All right? Then they might go to another hospital system and say, well, how about 18 million? And the same thing. Take another one, you say, how about 17 million? And they'll probably pick the one that costs them the least. But that group must take care of all the health care of this group of people. This is how capitalism will work. Number one is this competition. Well, that's great. And second of all, what do you think these providers in these hospital systems will do? They'll need pediatricians, family doctors, neurosurgeons, orthopedic surgeons in the hospital will look at this, and they in turn will go to groups of orthopedic guys, and they will bid them down. They will figure out, and I saw an example of that in Chicago actually, where the orthopedic group, for example, will have figured out digitally a person that is going to pay them X amount to take care of their orthopedic care, say for the year, X amount of dollars from the door in to the door out. And for things that could be avoided, like excessive knee surgery or excessive spinal fusions in my field, they would say to their surgeons, hey, don't operate. Operate only when you have to, when it's bone on bone. They will be, see, that's competition. That's true capitalism. And they will then be teaching wellness, how to avoid something, how to get at the root of a problem. And you know what's going to happen to the cost of health care? It's going to go down. Next year, General Motors may go to another hospital system, say, how about doing it for $15 million? So that there'll be some equilibrium eventually reached, and the hospital systems will push wellness as far as that they can to avoid the people having things done because it costs them money. Now capitalism is at work. Instead of now we pay per procedure, and not much negotiating going on. Medicare sets their fees, but they don't negotiate. They set them too low, so they're not even paying the providers what they actually reasonably should be getting paid. Medicaid is even worse than that, where when I was in practice, I was allowed only to treat 3 Medicaid patients per month. Why was that? Because when we saw a Medicaid patient, it paid less than the cost for us to provide the care, and it was breaking the cooperation. Mm-hmm. Fortunately, since I was seeing quite a few of these patients, I ignored the rule and get away with it. But the rule was 3. So other corporations, I know of some companies who don't see any Medicaid patients at all, because that's largely the poorer patients. That's how they get the Medicare money. So they don't see poor people, they don't see certain racial groups, they don't see certain ethnic groups. Is that fair? No, it's not fair. That's not me. Remember Americare? We're all holding hands. It's our moral obligation. We're all in this together. So you could see why I would not like that at all, and I didn't. But I'll say one thing, I'm doing something about it. I'm right here today. So I want you to join me. Contact your politician. Maybe establish a contact for me to get to the head of the Republican Party, the head of the Democratic Party, because I think somebody would propose this Americare. I think they win the election. I really do, because it's that important to us. Let me mention one other thing, which they do in France. For one thing, I think we need a complete system, okay? That you need it. You can't get around it. Call it what you like. But too many inventions going on. We just never had studies, and we just start paying for them, and we don't even know that they work. It goes on all the time. I've seen that, and that can hurt people. It can be very expensive. Things need to be evaluated, and there's costs involved, and we got to have a complete system so people know the cost. But if you had a health premium, in essence, a VAT tax, it's going to be increased, of course. Over time, things increase. Those increases could be done a lot easier, a lot quieter, instead of insurance companies say, well, we get a 50% increase in the rate this year. Well, since politics are involved a bit here, that's not going to happen in the healthcare premium. It can't be huge increases. They'll not be accepted politically. So so I think as a system that's more likely to work, it'll be easier to do some gentle adjusting from year to year, as well be necessary. I think actually if this is done correctly, the adjusting will be downwards. It'll cost less because of open borders nationally between the states, some elimination of unnecessary work, a reduction of the amount of narcotic scripts written. I think we need a new definition of pain, for example. We need to look at pain differently. It can't be, what's the level of your pain? It's a 9. Oh, here's your morphine. That's got to stop. That has to stop. That's what's addicting a tremendous number of people. Pain can be handled differently. Remember, get a little dog, or get a massage, or get a little a little exercise, for example. Certainly some things like cancer, different things, it needs a different way of treating it. But we're addicting a lot of people to narcotics. We doctored it. I wrote 3 books on pain because I noticed it. I did something about it. Wrote 3 books. Mm-hmm. Made TV shows on it too. Something which I'd like you to take an interest to a little bit. In France, they take a little credit card, okay, that size card. They call it Card Vitale, Card Health, okay? And on this, it has a chip on it, just like my credit card does. You put it in this machine in the provider's office, anywhere in France, up will come your lifetime health history. Isn't that wonderful? My God. And in France, you can see any doctor you want to under their system. It was voted the #1 healthcare system in the world. Mm-hmm. What do you think? The U.S. came in 30-something. Mm-hmm. Yeah. And if they really knew what's going on, they make it 50-something. Because I know, I was there. I saw all the addiction. I saw all the unnecessary surgery. I saw the lack of wellness teaching. I know what's been going on. That's why I'm involved, okay? Yeah, the card vitality has everything on there, and if you did some proper testing, for example, to avoid diabetes, especially type 2, is critical. And if you had a card vitality, you could establish some graphs, and they have a red zone, a green zone, a white zone, and as they check your serum insulins and your blood sugar levels starting as a child, you could follow this graph, and when you see us getting closer, you could then do corrective wellness teaching. Put the patient in a room, and it could be done beautifully. For example, the patient could have a band or just a card in the hand. Yeah, just have the card in the hand, walk in the room, and the computer goes on automatically, and the face of the computer, the screen, is the wall. Huge. Reason I like that technology is being worked on. I met some guys in Florida who were doing this. Almost took a job with them. It's true, about 5 years ago. And so the doctor can then look you in the eye and say, EKG 2020 March, and bingo, it's on the wall. Instead of him going to his computer, and he's not looking at you, and he's punching about 500 keys, and finally finds that EKG he's looking for. I believe me, I've been through it. I've been through it. I use that EPIC program, which is nationally almost, to dictate an op report. I think took 500 hits of the keys, 20-minute operation, 30-minute to dictate. Ridiculous. And they designed it that way. I've spoken to workers here. It was designed that way to complicate it so they could create a lot of business for themselves, just like medicine. No different. No different. They made it so complex because it could be simple. I should be able to go to my computer and say, op report, one hit. Then use Dragon, dictate the report. That's it. No. They had to invent this thing so complex. Again, that's the way industry operates. But I like that healthcare card because we then, and then even on the card, if you have a certain diagnosis like type 2 diabetes, or vascular disease, or whatever, all related to diabetes, incidentally. That's what causes it. But then that could lead right to a wellness program, right off your card. You home, put it to a screen, and it tells you exactly what you need to do through a mind map, which tells you what you need to do to get rid of your disease, and maybe gives you a reward for doing it. Not a bad idea, you know. You get rid of it, you get $500 or something. It could be done. Or you stop smoking, you get X bucks. It could be done through even a reward system. So I do think we need a total system of healthcare. What we have now is so fragmented. We have so many people charging huge fees for things which maybe even could be avoided. Okay. Now we mentioned we need a new definition for pain to avoid this overuse of medication. And I put together what I call the Magic 8 because becoming healthier, you must participate in your healthcare. You can't just, here's your script, you take it and you fill it and you don't do any reading or get other opinions. I was talking to somebody the other day, and they had a 6-year-old child, and the dentist wanted to, I think, do major surgery on about 6 or 8 teeth, and 6 years old. Mm-hmm. And you ask yourself, well, how come this problem occurred? Probably eating a lot of sugar. Although family claims they don't do that well, they claim maybe what's wrong. If you're eating the wrong food, it's your biome that have in them bacteria that regulate your health, and those bacteria work their way into your gums. So maybe that's a problem, but maybe that's a different way of dealing with it. So second opinions can be important. Somebody wanted to pull out the lower teeth of my wife, for example, and a guy, that was my dentist. So we providing business there, and she decided not to have it done, get another opinion, and that person said, you don't need those teeth removed. So second opinions are important. Again, that dentist was getting paid by procedure instead of maybe a capitated fee, but dental care is part of your program, and he gets the money whether he sees you or not, or sees you because he did a wellness exam on you, for example. Then he gets paid. You see the point? So we need to change health care. Again, how are we going to get this program, Americare, how are we going to get this passed? Am I just dreaming? Am I in a dream? I don't think so. I think it's one way a person could indeed win an election, because it is more important than anything in our life to be healthy, to be happy. To be happy, it saves us a tremendous amount of money in medical care. We could get our eye examined, we could get our teeth fixed, and if we made wellness a big part of this, and if we had some capitation products, not everybody needs to be on that, but the big companies, say, had capitation products, their healthcare expenses wouldn't go up as much. Their patients would get less unnecessary surgery because whoever is carrying the capitation contract, whatever hospital system has that, will find that if they keep you well, do less procedures, give you less medication, it's going to cost them less money. They make more money, and you get less unnecessary surgery. So I think it's a good idea, and I feel it's our moral responsibility to treat everyone the same. For all these problems we're having with the Corona-19 virus, for example, there are some people who have jobs where they're more likely to be exposed to it, but actually I think a bigger factor is that these people who have these jobs have a lot of chronic disease to begin with. Could be that they're stressed, so they're eating more sugar and gaining weight and getting diabetes. Although I'll tell you something, diabetes occurs before being overweight. Mm-hmm. Mm-hmm. That's been proven, and that has been proven. Joseph Kraft, K-R-A-F-T, you can find him on YouTube. Joseph Kraft, K-R-A-F-T. You can find him on YouTube. He published a book. You wouldn't believe this. 2006, based on research in the 1970s or so. Mm-hmm. Autopsy, 3,000 people. Mm-hmm. 3,000 people. Then his fellow doctors at the University of Illinois, his fellow doctors studied about 14,000 patients, okay? And what he found was that the serum insulin, which is the one that takes sugar and stuffs it into the cells, okay? That's serum insulin's job. And he found that the serum insulin is raised a lot earlier than the sugar. And the reason being, if you take one cell, they got receptors, okay? It's insulin's job to push sugar in the cell for energy. They hit these receptors. That's a door opener, okay? A GLUT4 hormone comes to the surface and picks the sugar up, takes it in the cell. But because triglycerides are making these receptors sticky, insulin can't get sugar in the cell. But for a long time, the sugar level is normal, but the serum insulin level keeps on being elevated. And if we check the serum insulin level in people, even as children, as teenagers, even while they're in the schools, at a very young age, we would catch people on the road to diabetes and its 30, 50 diseases that are attached to it much earlier. Yeah, that's where early screening will be important, and to get the provider to be paid for screening, it's going to more likely to happen. You're going to call you up and say, get in here. You got to get screened. You got to get your immunizations done. And so call on your politicians. See if you can arrange for me to speak to them or refer them to this show, which will be in public access. This will be in the next 2 Wednesdays, 6 o'clock, for example. And then it will be moved to YouTube. It will be moved to YouTube. And so they can put in YouTube Rudy Cashman, Americare, and the show will pop up. So that'll be easy. I will also have it posted on Facebook, Live to Be 100, Facebook, Cashman. They'll be posted on there too. And at the moment, I'm finishing with a program, and I think it'll be on Saturday. I'm going to get a barcode that will be on a piece of paper you can get from me, that will lead right to the Facebook, the YouTube shows on how to stop, prevent, reverse diabetes. It'll be Rudy's War on Diabetes, because that has so many diseases attached to it which can be avoided. That's the beauty of it. And if you have any other ideas, let me know, but don't be closed-minded, because this is an idea, and if we're going to change our democracy, this is really the way to do it, by going out and voting. And if you get this to your favorite political candidate, I think he might win the election. I actually gave it to people politically, locally here. She decided not to use it. She lost the election by a lot. I don't know if it's related to this or not. Then I gave it to a guy from South Bend to see he might use it. He didn't use it either. And he's not, at the moment, running for the presidency. And I didn't say this might have made a difference, but people are looking for health care for everyone. Maybe it would have made a difference. But now you can see where this election is coming up soon, and I personally feel that if someone would develop a program that covers all the people, remember I said we would upgrade Medicaid, Medicare would still be there, except even be better because it includes dental and eye care. Veterans would have a choice. People with no insurance now have insurance. You don't get a bill for and you don't have huge deductibles. And the way to pay for it is to add a little bit of healthcare premium, in essence, about tax to every financial transaction. It's not going to be for free. Everybody has to pay something. And anyhow, appreciate listening to me, and to have other people look at the TV show, or if you wanted to get the book Americare itself, very cheap, I don't know, $5 at best, on Amazon. Amazon books, Rudy Cashman. Scroll through about 20 books that I've written, and you can get it there. If you see me in person, talk to me. If you want to see a doctor for free, I see people on Fridays at the Three Rivers Pharmacy. You call them, 373-1083, ask for Sheila. She'll give you an appointment. I'll see you for free. You want to get rid of diabetes? I'll show you how to do it. I've done it to people many times. Appreciate you watching this show. Thank you. Namaste.
The views and opinions expressed